I'm Eileen Faxes, coming to you from the University of Miami's Miller School of Medicine, specifically the Medical Wellness Center, where we are experiencing the first ever integrative medicine symposium and expo put together by the chair, Dr. Janet Knefel, and the co-chair, Jennifer Pinto. It's a big deal. It's the first time that anything like this has ever come to the University of Miami, which is really at the vanguard of this movement where complementary and conventional medicine meet.
My name is Pascal Goldschmidt.
My name is Janet Knefel.
I'm Jennifer Pinto.
I am the Dean at the Leonard Miller School of Medicine at the University of Miami.
I'm the Assistant Dean for Complementary and Integrative Medicine.
I'm the Associate Director for Wellness here at the University of Miami School of Medicine.
We're going to take you inside the speeches, the booths, and make you feel as if you are there.
Integrative medicine is a very, very exciting part of the progression of medicine in the United States and the world. And when you see a jam-packed room like the auditorium that we just left, you realize that there's a huge pent-up demand for integrative medicine.
We have speakers from all over the United States. We have researchers, we have clinicians, we have allied health professionals, and they're all coming together in a very synergistic way.
It's a wonderful group of people because everybody has a common goal here, and that's for the best choices for the health of every individual patient.
What I loved was everybody's healthy, everybody's excited to learn, they're looking through the different seminars that they're offering.
The medical students have been great. It's been fun working with them. A lot of interest in what we do in therapeutic laser. We also work with the Alternative Medicine Department through Dr. Knefel, and we're designing some research projects with the University of Miami.
Our lecture rooms on the first floor, we've had overflowing all day, and we had an amazing turnout for our dean's opening remarks.
Well, I think it's very good to have it here at the University and Medical School, as it comes closer to integrating those things that work in standard and orthodox medicine with the best of traditions.
To have this so available to the medical students now, it's just great because then they can blend it in with what they're learning. They have other options besides what they're being taught.
Well, I'm particularly excited to be here because I've been practicing natural medicine since the mid-70s. To be here now and to see the kind of the openness and the excitement in the medical community to work together, it's a dream come true, actually.
First time in a long time that I've been in a program where I get to talk about nutrition that has been part of a medical institution.
I think it's an opportunity to come here to the university, meet people like myself who are doing research in this area, see other investigators, see the response from the students, see this wave of interest that hopefully we'll build today that will springboard us into bigger and better things in the future.
Today that it's finally reached this level is just such a great thing. It's such a great tribute to just what's happening in the whole field of complementary medicine in the country and on the planet.
I've never seen anything done like this, at this med school or any medical school. So, now that I'm here, it's just so well put together. All the presentations are great. All the vendors have great information to offer. So I think it's going to be something that's just going to continue to grow year by year. I think it's just going to be a positive for everybody involved.
Now we are approaching probably what is the most coveted area of the symposium, the spa. Oh yeah, this is the place to sign up and actually get a little hands-on action.
We want people to get an idea of what it's like to have acupuncture.
I'm feeling fine, feeling great. As a provider, I'm interested in learning more about providing it, and I was already interested before today's experience in having it done to me.
You just came out of this neuro-emotional technique. Yes. So I could see in your face that you've just had an experience.
I really did.
Tell me, what do you do in there?
We work with the acupuncture system. We use the muscles of the body as a biofeedback instrument to release the emotional charge on the point, and then people get an emotional release, and then they get to feel better and happier and healthier and all that kind of good stuff.
I am a rehabilitation chiropractor, and we do specialize in therapeutic laser, class 4 laser. It's a surgical power laser, but it has a therapeutic wavelength where it accelerates tissue healing.
This is quite exciting, actually. I feel like I'm at the vanguard of medical technology.
It's kind of like shining a flashlight inside your body. It's an infrared laser, so it does penetrate deep. It will go through the skin. And we can reach down to swollen joints, swollen nerves, And the warmth is almost just a byproduct. There are a lot of chemical changes going on inside your body right now as far as anti-inflammatory changes, muscle relaxation. It does change the mechanics and it can help the rest of the joint to heal.
Integrative medicine pulls in technologies and practices that may not have been part of the traditional field of medicine, but nevertheless, patients have found it and are seeking it for now a long time.
I think the legitimate aspects of the pieces that are being developed in integrative medicine will eventually move and be accepted and utilized within the scope of what you would call traditional medicine.
There has been a huge paradigm shift. We use clinical research to help bridge the cultures so that we learn the secrets of health and longevity from the East. At the same time, we validate the Eastern traditions through clinical research. We actually can now participate in a complementary way, both with nutrition and exercise in a slow and gentle way.
At Canyon Ranch, the healthcare that we'll offer does have conventional medicine as its foundation, but it's very much expanded. So my team includes Chinese medicine practitioners, nutritionists, exercise physiologists, physical therapists, mind-body specialists, yoga therapists, body workers, and so on. People have an opportunity to really live what it is they want to be living and enhance their life overall.
We've actually partnered up with the University of Miami Wellness Center.
And the idea is to build a healthy community by offering good food and educating them how to lead a healthier lifestyle.
The body is a puzzle. And so all these representatives here at the Expo have a piece of that puzzle to offer, as do the different practitioners.
I think that this is the future of medicine. The unification of contemporary with complementary is the way to go. I believe that this is just the beginning.
And then with Dean Goldschmidt, he really wants to promote integrative medicine and bring it all together.
To integrate complementary medicine within traditional medicine is really a wonderful opportunity, and I can guarantee you it will happen at the Miller School of Medicine.